Chronic obstructive pulmonary disease, or COPD, is a serious lung disease. It primarily affects the lungs and airways, making it increasingly difficult for individuals to breathe as the condition progresses. It makes it hard to breathe and gets worse over time. Symptoms often include chronic cough, frequent respiratory infections, and shortness of breath, especially during physical activities. The airways in your lungs become inflamed, making them swollen and filled with mucus. This inflammation and mucus buildup obstruct the airflow, leading to persistent breathing difficulties. This makes it difficult to get air in and out of your lungs. Over time, the lung tissue can become damaged, further exacerbating the problem. COPD is a leading cause of death worldwide. It is often caused by long-term exposure to irritating gases or particulate matter, most commonly from cigarette smoke. But there are things you can do to manage it and live a full life. Treatments include medications, oxygen therapy, and lifestyle changes such as quitting smoking and engaging in regular physical activity. COPD symptoms often develop slowly, so you may not notice them at first. This can make it challenging to diagnose in the early stages. The most common symptom is shortness of breath. This can be particularly noticeable when you exert yourself, such as during physical activities. It may be mild at first, only happening during exercise. However, as the disease progresses, you might find it difficult to catch your breath, even during simple tasks. As COPD progresses, you may feel breathless doing everyday activities. Other symptoms include wheezing, chest tightness, and a chronic cough. These symptoms can significantly impact your quality of life. You may also cough up mucus, especially in the morning. This is due to the increased production of mucus in your airways, which can lead to frequent coughing and discomfort. Smoking is the leading cause of COPD. Cigarette smoke damages the lungs and airways. Long-term exposure to other lung irritants can also cause COPD. These include secondhand smoke, air pollution, and chemical fumes. In rare cases, COPD is caused by a genetic condition called alpha-1 antitrypsin deficiency. Early diagnosis of COPD is crucial. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that makes it hard to breathe. Identifying it early can make a significant difference in managing the symptoms and improving the patient's quality of life. It allows you to start treatment sooner and slow the progression of the disease. Early intervention can help prevent further damage to the lungs and maintain lung function for a longer period. Your doctor will perform a physical exam and ask about your medical history. This includes questions about your smoking habits, exposure to pollutants, and any family history of respiratory diseases. A simple breathing test called spirometry can diagnose COPD. This test measures how much air you can inhale and exhale and how quickly you can empty your lungs. It's a key tool in assessing lung function. While there is no cure for COPD, treatment can help you breathe easier. Management strategies include medications, lifestyle changes, and regular monitoring to keep symptoms under control. Medications like bronchodilators and inhaled steroids can open up your airways. These medications help relax the muscles around your airways and reduce inflammation, making it easier to breathe. Pulmonary rehabilitation and oxygen therapy can also improve your quality of life. Pulmonary rehab includes exercise training, nutritional advice, and education about managing your condition. Oxygen therapy can help maintain adequate oxygen levels in your blood, especially during physical activity or sleep.